My treatment philosophy is based on years of observation, which is that people are complicated, and so is medicine. Most importantly is you have to take the whole person into account, their life, their lifestyle, and you can't address just one problem without thinking about everything else. I try to take all that into account. For example, if you are worried and you're worrying about everything and you can't sleep, your blood pressure is going to be terrible. You may end up with not getting any exercise because you feel tired all the time and then have arthritis in your knees. And so you could have bad knees because you can't get to sleep. And that sort of thing is actually very common, and that's the sort of thing I try very hard to get that relationship with the patient, more personal, talking about life and their goals in life. It is a great group of people. It's a family. It's not just the buildings. It's not just the equipment. There's great doctors and nurses and nurse practitioners. We have people coordinating in, all of your appointments together. And now we have this great new electronic medical record where all of the doctors can instantaneously find out what the last doctor has done. I'm very proud to be part of that, and I've been out as a private practitioner for a number of years, and this is better. This is the best coordination of care you can get for 1,000 miles in any direction. Me personally, I'm not a very formal person. I like to get more of a personal interaction with people. If they want a more formal physician, perhaps I'm not the one. But I do like to try to help people with what they think is important. What do they want to do with their medical care? And I'm also, I like to talk. I love to explain things to people. So many times people come to me after seeing somebody else, and they go, I just had this test done, and I don't know why, and I don't know what it meant, and they said it was okay. What happened? And I really, really like to communicate and explain medicine, medical care, medical problems, and the path we can take in medicine to try to help with all these chronic diseases that so many of us have. Changing what's possible for patients is why you go to a doctor. I'm a bit of a bookworm. I like to study things, and if you look at the average lifespan of people just 200 years ago, it was about 40, 45 years old. Medicine helps. That's why people are living longer. They certainly exercised more 200 years ago than we do now. Obviously, that wasn't the key. It's everything, but especially medicine helps. And we're changing what's possible for being vibrant and healthy in spite of having problems like high blood pressure and kidney problems and so forth. That doesn't have to take away your fun and your enjoyment and your energy level. And that's one of the first things, what's possible. The other thing that's interesting is when you're in a wonderful environment that's encompassing, like the medical university, it suddenly becomes refreshing in that you don't have to go to this person and that person, and I didn't get your blood test back, I'm going to have to repeat them because I don't know if they're ever going to send them to me. We don't have to do that anymore, and so we're giving better care, and we're changing it what's possible, how to get in to see a specialist. If I need to refer you to a specialist, it's much quicker, half the time, to get a referral that you need. We can coordinate the care. What's possible in medicine is a better life, a better lifestyle, and a healthier and happier person.